optimization, and conversion risk mitigation. Amanda Vallozzi is an associate director at Navigant who has managed various revenue cycle initiatives aimed to mitigate professional and hospital-based operational and financial impact due to next-generation electronic medical record conversions. And with that, I welcome Andrew and Amanda and hand it over to Andrew.
Great, thanks. Thank you very much, Maureen. So Amanda, if you want to jump to the next slide, for us, we'll talk a little bit about the agenda here. So, as Maureen mentioned, my name is Andrew Hancock. I'm a managing director. I've been focusing on revenue cycle optimization consulting for 10 plus years now. And I would say over the course of the last 5 to 6 years, a heavy emphasis on revenue integrity. So I think that'll be the focus of our conversation today. So a couple areas that Amanda and I will cover. We'll talk about some of the components in Navigant's position or stance as it relates to revenue integrity and what functions we see being a part of that area. We'll talk a little bit about some of the success factors, and Amanda will walk us through that section. We'll talk about KPIs in regards to what are some of those key metrics that we would recommend for you all measuring as you go about implementing, or if you already have implemented revenue integrity departments, then some key indicators we would suggest being part of performance metrics for the area. And then we'll wrap up with a couple case studies and then open it up for questions. What I would also say is I think the line is open for questions throughout, and Amanda and I are more than willing to take questions as we go and encourage the group to interrupt us at any point, and we'll also try to pause for questions throughout and try to make this as much of a dialogue as possible. So jumping into the material, when we think about revenue integrity and kind of the purpose, we see revenue integrity as being that quality assurance within the revenue cycle. So I think oftentimes revenue cycle can become a siloed area that lacks integration with clinical areas or finance or some of the other areas that we'll talk about in the upcoming slides. And we really see revenue integrity being that function that serves as the liaison between the different areas. What I would also say is that, I think there's different positions or perspectives on revenue integrity and whether it's a gross or net revenue capture function. I think as it relates to our perspective is we really see revenue integrity being the protector of gross and net revenue. So how are we making sure that we're capturing all of our charges, doing revenue reconciliation, looking at charge edits, whether that's internal, using vendors, et cetera, or whether it's looking at underpayments or denials and write-offs, and how do we maximize the net reimbursement on our collection. So we see the two really being hand in hand and recommend that as a strategy for the department. What I would also say is from our perspective, I think revenue integrity can also sometimes be interpreted as a functional area. I think from our lens, we see it as a functional area, but we also see it as a distinct department. So whether that reports up to the VP of revenue cycle or whoever else that may be overseeing the revenue cycle, we see it having a distinct swim lane and an org chart rather than just a task force based approach. So definitely wanted to clarify that as well. So as we move into slide 5 here, when we think about revenue integrity, some of the key functions, and I alluded to this on the gross and net. So if you look in the upper left-hand corner, CDM and pricing and charge capture. So those are really probably the biggest drivers of the gross revenue capture, right? So how do we make sure that our CDM is being maintained, that if we have new service lines that are being developed, that there's a strategy for updating CDMs, et cetera, and then our pricing strategy. So how are we making sure that we're making routine updates to prices as well as strategic pricing? I think the pricing piece, obviously, when we're thinking about strategic pricing, there's a element of both gross and net revenue capture. We don't want to just increase our gross revenue without it yielding additional net revenue return as well. So that really bridges the gap. And then on the left there, charge capture. So this as it relates to documentation, timely charge capture, reviewing charge lag, making sure if clinical workflows based on your EMR environment drop charges, that there's education that's appropriate, as well as overseeing some of the charge reconciliation process. So how do we make sure that some of those clinical departments are reviewing their revenue on a day-to-day basis and making sure that we're capturing everything that we should based on the acuity of the patients and procedures, et cetera. If we look on the right-hand side, the two areas that I mentioned on the previous slide, denial prevention. So, the denial work, may be live within your patient financial services office or that specific area of the org chart. We see revenue integrity being more of the prevention committee or the prevention liaison, where they're looking at trends in our denials and write-offs, coming up with root causes in partnership with the different areas across the revenue cycle, and then developing strategies to mitigate those going forward. I think why revenue integrity as an owner of this versus some of the other departments within the revenue cycle, in our perspective, is that revenue integrity can really be that neutral liaison where revenue integrity themselves is likely not causing the denials or the write-offs, but they can collaborate with patient access, HIM encoding, case management, back end as it relates to timely filing, and really come up with mitigation strategies with all of those different stakeholders. And then the last one on the right there, payment variance. This is as it relates to making sure we're being paid what we would expect, whether that's leveraging internal contract management tools or leveraging external vendors to do a scrub of our $0 receivables and seeing if there's additional collection opportunities. So I would say those top four that I mentioned are really the primary areas that we see as being part of revenue integrity. A couple other areas that we see in some organizations being integrated. The first on the bottom left there is CDI, so clinical documentation improvement, and how that relates to ensure that we're capturing the appropriate acuity and other things of our inpatient stays, as well as the evolution of looking at outpatient. So how are we making sure that we're capturing the appropriate E&Ms and other things in the outpatient space. And then in the bottom right corner, I would say is the last one that we probably see less in this area, but is definitely a potential, would be compliance-related audits that may live within a separate compliance department as it relates to charging and doing detailed reviews to make sure that that everything is in order from a compliance perspective. So I'll pause there to see if there's any questions from anyone on the group. Okay. All right, so let's go ahead and go to the next slide, Amanda. So, I mentioned this, in the kickoff slide there, the first slide of this section, is we see rev integrity really being the hub and spoke of this, of integrating the different areas. So you see revenue integrity in the middle here. There's going to be a integration point with finance, managed care, the rest of the revenue cycle, clinical areas. And so really having someone in the middle that can help someone and a group of people that can help the collaborative efforts across those different stakeholders. What I would also say is that, as you can see with the individuals that revenue integrity is interacting with, it often requires, highly skilled individuals that have a bridge of both clinical, operational, financial experience, and maybe not every individual all of those experience, but from a collective group, there's really a lot of outreach to different departments and different stakeholders, and so making sure that there's the appropriate skill sets within that team is highly important in order to make it successful. So if we go to the next slide, so here's another image just to look at it a little bit differently. You can see, from left to right, some of the documentation and CDI that we've talked about, CDM and pricing, denial management. A special focus would be within revenue integrity is that charge related. So I would say the majority of the denial management within revenue integrity is more coordinating efforts across the different areas, but there is things that are related to the CDM or charging that may be a direct result of the rev integrity work. So there probably is a little bit of a subgroup there that the denial management group would focus on. And then on the gross charge capture, I think the other piece is just claim edit review and revenue reconciliation. So, we talked about a little bit on the high level slide, but there really is probably an aspect of actual throughput as it relates to charge edits and other things that may be preventing claims from going out the door. So while the majority of their work from a revenue integrity perspective is probably more coordination, leveraging reporting, working with departments to ensure they're capturing all their charges, there is a small portion of that may actually be throughput work in regards to working edits in the system. And then the last piece is the training and education. So how are we making sure, based on the trends that we identify, the work that we're doing with the key stakeholders, that we're training and educating people across the revenue cycle, but even probably more importantly, individuals outside of the revenue cycle. So if we're seeing certain issues within the clinical area that may be related to ABN workflows, how are we working with the operational and clinical stakeholders within that area to ensure that ABNs are firing appropriately and are being leveraged to receive signature. So making sure that there's that bridge between the revenue cycle and the clinical / operational areas. Any questions about any of that, or anyone on the group have any other areas or experiences they've had that they would also group into the revenue integrity structure from their perspective? All right. Amanda, anything else you want to add on these couple of slides before we jump to the last slide of my section and turn it over to you to talk about success factors?
No, I think you really hit upon everything. I think it's just, reinforcing that, this is a functional group of people that have, experience and some knowledge across all these areas that can, really act as that kind of watchdog across the entire organization to make sure that they're connecting all the right people and, making sure that, looking from front all the way through the back end and payments and picking up patterns and helping to plan and put forth strategies to improve that growth and net revenue.
Sounds good. So the last slide here, and then I'll turn it over to you, Amanda. I think it's just, the importance, and I would say almost like a one-page slide as a business case. So for any of you that are looking to try to implement revenue integrity programs and want a quick slide that you can leverage to reference with your teams, I think this really paints the picture. So, what are the positives when it comes to revenue integrity? The centralized committee, increasing transparency and goal setting and achievement, which we'll talk about the KPIs here in a little bit. Liaisons for gross and net revenue, decreased risk of inaccurate charge capture, and then increasing that communication across the organization. And then on the flip side, you'll see some of the mixed messages, silos, some of those things that I think from a revenue cycle standpoint are very difficult to overcome without the inclusion of a revenue integrity program within the revenue cycle. So I think this should hopefully be a reference point for you all as you're potentially making business cases to implement revenue integrity and or expand your programs. So Amanda, I'll turn it over to you then if you want to talk through some of the success factors in regards to implementation.
Absolutely. Thanks, Andrew. And as Andrew said, please, as we're going through these slides, interrupt me, jump in, ask questions as we're going through it. If you'd like me to elaborate on something more than I am, please, by all means, do so. So from a success factor, when developing a successful revenue integrity program, we're going to talk through it in terms of people, processes, and technology, and how to approach setting up your revenue integrity program through your revenue integrity department to make it successful. So the first area that we're going to focus on is people. So taking a step back and really looking across the organization and identifying all of your key stakeholders that in some way impact or touch your gross and net revenue capture across the organization. So we've included some examples there. So if you think about your strategic decision makers, right? We see this a lot with the executives of the organization. Who are really those people that you can get real-time decisions made or answers to as you're coursing through or you have findings and need to make changes? Who are really those individuals? Your clinical service providers. So when you're thinking on the professional side or on the hospital and technical side, who are those individuals that you would need to include that have the most influence on a day-to-day basis with the gross revenue capture, as well as looking at their net revenue impact to their practices that they're looking at. So we see this a lot with, the directors or vice presidents of clinical operations, your nursing units, radiology, your physician practices. Frequently, and what we've found very successful too, is engaging some of the actual providers or your physicians in this process through this, maybe having a physician champion. Payer and contract experts. So these are the individuals that really understand your managed care contracts, what are the language in them, how to approach it so that you are really optimizing your net revenue benefit through that gross charge capture, as well as having the ability to get some real-time or quick answers around questions to denial patterns or underpayment patterns that you're seeing. Then you have your billing and financial specialists. So when you think about this, again, it could be inclusive of, your pre-AR workflows. So when we're really looking at claim edits and anything that they're reviewing prior to it going out the door. And then again, your denials teams, underpayments, specialists, and or just AR follow-up if they're starting to, find certain payer-related patterns or issues in receiving timely payments back in the door. Some other folks that we haven't listed on here, but we would typically include in this process again, like Andrew mentioned, you have your CDI coding folks, you may have your compliance folks. Can't forget your IT folks. So if you're running into something and maybe it's a technology issue or you have a question about workflows, that's where your IT individuals are going to become important. Training and education, making sure that you have your training team, tapped into what's going on in case you need to roll out a training schedule to help improve any processes or workflows that you identify. The next important thing regarding people around defining goals and an accountability structure. So when you look at defining those goals, making sure that you are very specific around what are individual goals. So for all of your key stakeholders that you have included or involved in this process, what are all of the goals that they're going to be held accountable to throughout the course of the year and subsequent years moving forward? And then how do those individual goals tie into the system goals related to your gross and net revenue improvements? And then who are the individuals that are responsible for attaining those goals? And this is important to actually assign specific names. So, it's Joe is responsible for this and Beth is responsible for this area. And it's making sure we're holding those individuals accountable, on a recurring monthly basis when we're looking at that. It's also important from an accountability structure. So let's say Joe is not meeting the goals that you're reviewing and looking at, who then is that, next individual up that would help work with Joe or hold Joe responsible if he's not achieving those goals that he needs to be. And then thirdly, creating communication paths across all of these stakeholders. And so I think something important with revenue integrity is it's taking all of these individual silos and all of these individual processes that are happening across your organization, and they're really that liaison or that bridge between all of them, so that everybody is aware, here's what's going on with our denial. These are the patterns we're finding. This is how we think we should correct them. Here's what we're saying with our gross revenue capture. Here are the areas that are doing it well. Here's where we're having some issues. And so they're really the ones that need to tie all of those various groups that we talked about together. And whether that's through steering committees, we found holding monthly steering committees where all these individuals are sitting in a room focused on this really works well. And then having service line working groups. So let's say they're finding something within this is just an example, a cardiology or cardiovascular service line, they're finding some issues there. Outside of those steering committee groups, they'd have working groups with those key stakeholders within that area to start trying to figure out root cause analysis and what are some things we can do to prevent this moving forward. And so most importantly, and we'll talk about this when we get into technology as well, but really what reports and dashboards are you using to help hold people accountable to the goals, to help you with your root cause analysis or finding patterns or finding issues within these processes. What's included in those reports, what are driving them, and making sure that everybody understands that and is on the same page. Any questions with people before we move on to processes? Okay. So when I start thinking about processes, similar things. So taking a step back at the very beginning and looking at and identifying all of your key processes that somehow interact with gross or net revenue capture. So again, we've included a few examples. This is not, exhaustive by any means. But if you think about, your pricing strategies and fee schedules, your payer strategy, CDM charge capture, your CDI and coding, billing follow-up. Within these are, I would say, kind of umbrella categories, but, for example, your CDM and charge capture, within there's going to be, finer level processes that you're going to want to look at. So within each of the areas, how are you capturing these charges? How are you completing revenue reconciliation? What does both of those processes look for? For the CDM, what's the processes for, auditing or sampling that CDM to look for accuracy? What's that annual review process to add new CPT or HCPCS in there? Again, billing and follow-up workflows. We're talking about denials. Do you have a focused denials management and prevention program right now where, you have clear processes around how you're identifying trends with those denials? Do you have an underpayment team? What are the processes around reviewing those underpayments? So once you've identified those processes, it's really taking a look and assessing that current state that you currently have. And so what we like to do is take all of those and start bucketing them. So you might identify, okay, we have these processes, it's working well, everything's great. If it's not, I like bucketing them under, we're missing this process. This process is underdeveloped, meaning we need to kind of hone it, look at it with a fine-tooth comb and maybe evolve or change or add something to the process. And then underutilized. You have a strong process documented and in place, but it's really not being used by the appropriate people at the frequency that it should be. And so once you've identified it and kind of lumped all of these processes under, it's functioning or it's missing, undeveloped, and utilized, then you can start working on the next, which is the future state plan and implementation schedule of really prioritizing, right? Is this something that's, low cost and it just is going to require some additional, training or additional information getting out there, kind of reinvigorating that process? Or is it going to take more time? It's a missing process or underdeveloped where you're going to have to whiteboard out, what needs to change. We need to, add a new process. We need to, add individuals. We need to shift individual responsibilities. There's a technological component to it. So then it comes into what are some of those quick wins you can get through versus some of those things that are going to take more time. When you're looking at that future state plan then and looking at all these processes, it's really important to understand how long and how much work is going to go into all of these changes or evolving processes that you're working through. And so taking a step back and actually completing an evaluation of resource needs. So to be able to do X within X amount of time, we're going to need to have this many people. I think one of the things we see when we come in too is understanding that you're changing, evolving, creating something that is on top of what you are all doing every day in your, daily responsibilities and functions. And so understanding, how much time is realistic? If I need 40 hours of work from a specific person, how many hours do they actually have to dedicate on a daily, weekly, or monthly basis to be able to accomplish that? And can you take that individual out for that period of time to be able to work on this? What's going to happen to the other functions or responsibility that person has? Once you've gone through all of that, again, assigning owners, putting specific names next to each of these, and regularly checking in and committing to deadlines. So if you have a plan and you said it's going to take 40 days, 60 days, and making sure that you're holding people accountable to those deadlines or having honest conversations about why deadlines may need to shift or change or what needs to happen to make sure that you're actually meeting those deadlines. And then we go back to, again, goals and a clear accountability structure. So assigning multiple layers of accountability, like we talked about in the previous slide. So you have names for all of those. This goes into being consistent and having a forum to holding those people. So what is the actual process? It's a monthly basis. You're checking in on these goals. If people are unresponsive, frequently missing their goals or where they should be, what's that next step in the process? Who's that next person to kind of raise that red flag so that they can get involved and help you hold those people accountable?
Yeah, Amanda, this is Andrew. I think just real quick, I think your point around prioritization is really important. I think standing up a revenue integrity department or expanding on one can be extremely time consuming and can be overwhelming. And so, I think as we look at prioritization, we typically look at, what are those low effort items that maybe don't have as much impact, but they're really quick wins. And then balancing that with maybe the larger efforts where there's big impact, and how do you stagger those throughout to make sure that you're balancing the two while making sure that the work effort that you mentioned is manageable. So I think that prioritization step is highly critical in this process.
Absolutely. Thank you. Any questions from anybody on the phone? Okay. We'll move on to technology then. So similar to people and process, first step is identifying all of the different technological factors that are supporting or involved in your gross and net revenue capture processes. So if you're looking at, your EHRs, whether you have, Cerner or Epic, Allscripts, whatever it may be, looking through all of those processes that are involved or support the capture of gross and net revenue. Then looking at third-party vendors and tools. So, specifically in your managed care arena or your CDM and charge capture, or you may have a charge reconciliation or audit tool that you're looking at. Have anything supporting you from, like Andrew had mentioned before, from a payment variance perspective. Who are all of those, or what are all of those things that are involved and included that may be directly outside your system? And then reporting and data analytics. This is where we frequently see, there are opportunities to enhance and support revenue integrity's, infrastructure in that department as a whole. So what reports do you have right now? Are those reports consistent in the information that they're providing? Do you know what data is feeding those reports and where you're getting them from, so that you're easily able to explain the reports or dashboards that you're sending out to individuals, as well as making sure you have the information and data to be able to support, any type of root cause analysis that the team may need to be able to go in and do. So once you identify all those technologies, assessing them. So completing a cost-benefit analysis, really taking a step back and looking at all of your third-party vendors and tools to say, is this something that we can bring in-house? And is it cheaper to bring in-house? And can we get more use out of it? Do we have the right people to be able to do it? The right, electronic health record to be able to bring it in-house? If we are going to keep it external, are we using the right vendor? Vendors and technology change so fast in our environment. So really going back, reevaluating that on a regular basis to say, are we using, the best vendor we could, the best partner we could to maximize our gross and net revenue capture? And then really looking for opportunities to automate, whether that's through your own EHR or through third-party vendors. So taking some of that, touches by people out of the process. what can your system do for you that's automatically scrubbing or checking or looking for things, and kind of serving that up directly for people then to say, hey, we found that there are missing charges. Can you take a look at these accounts and verify that? Or we're going to go ahead and add on certain modifiers or things, for you within the system so that people don't necessarily need to be thinking through that. And then creating or adjusting the reporting package and dashboard. So like I was talking about before, right? Consistency is the biggest one. I think, looking at many clients, frequently what we see is your financial accounting or report analytics team might be looking at reports that have, certain information or data or metrics on it. And then you go and you look at your revenue cycle or, clinical operations, and they're looking at something completely different. So making sure there's consistency in the reports that everybody's looking at across the organization, and that consistent data is driving those reports. And these reports really will, when we're talking about a holistic infrastructure around this, are critical to being able to meet individual and system goals that you're setting forth. So any questions about technology? Andrew, anything to add here?
Nope, I think you hit on it.
All right. So if there are no questions, we'll move into just some key performance indicators. So talking about reporting, it's a nice bridge into what are some of the metrics or the key performance indicators that we like to look at when we're starting to build out that revenue integrity program. So if you're looking at it from a gross revenue capture versus a net revenue improvement, typically, and again, this is not entirely exhaustive, I think, based on the individual organization, there may be things that we're including in here, like CDI, coding type of metrics that we'll see in here, other type of financial indicators we could include in here. But for the most part, charge lag performance, understanding your cost center revenue, volume, and acuity trending. So understanding, as your revenue dropping just because you have a shift in the number of patients that you're seeing, is it due to a shift in acuity that you're seeing based on the time of year? Making sure that you have a comprehensive look at your revenue so that it's answering the questions for you instead of just saying revenue's down in this one area or up in this other area. What are the drivers that are leading to that revenue being high or low? Looking at your professional pre-AR or your hospital DNSB pending charges. So, how much do you have sitting in there on a regular basis? How long is it taking you to work or clear all of that out? What are the patterns or trends within that? Your revenue reconciliation performance. So how frequently and who is completing revenue reconciliation before that goes out the door to make sure that, one, you have all of the charges and that, two, those charges are accurate and appropriate. And then something to identify those missed charges. So if you're looking at, accounts, how many accounts are sitting out there that have no charges on them at all, for example. Or this might be something external to the system, a retro audit reviewing and providing to you a list of, potential opportunities for consistently missed charges. Then you have your net revenue improvement, so your denial volume. How many denials, what areas, what are the sources of those denials coming in? Your avoidable write-offs as a percentage of your gross and your net revenue. Making sure that we're consistent in how we're writing and how we're labeling those write-offs in the system. How are they fluctuating? And then your underpayment recoveries, both internal and external. So are we doing a good job? This is a really good area to break it down at the payer level with your net revenue improvement. So, looking at a payer and saying, okay, we're seeing increasing denials with this one payer, or this, we've seen a spike and this payer is, denied, an extremely high volume around, various factors there that you could look into and go back to that payer through the revenue integrity program and payer strategy to come up with a plan of action to avoid that from happening in the future.
Yeah, and
So
Amanda, I would
questions?
just mention, I just quickly mentioned on the write-off side and the denials, probably more the write-offs though, is yeah, I think the nuts and bolts of your EMRs are highly critical in making sure that staff are, well, first, I guess that you have the appropriate write-off codes to distinguish ABN-related issues from timely filing, from authorizations to whatever the case may be, but then also that there's quality controls in the system to make sure that staff are using the codes appropriately so that your reporting and your metrics are meaningful. So I think the nuts and bolts, definitely shouldn't be overlooked in regards to making sure that the program is successful.
Excellent. Any questions? Are there any other, metrics or key performance indicators that, we're not talking about here or touching on that you have found beneficial? Okay. So we're going to go ahead then, and we will move on to some client case studies. We have two different clients examples here that we'll go through, and I'll touch upon the one in Andrew, I believe. If you want to jump in at all and kind of paint some color around any of these areas for us, feel
Sure.
free. So this system here, just a quick overview, was made up of 3 hospitals, had 8 outpatient facilities, as you see, over 1,000 licensed bed and 1,100 employed physicians. And so this was really twofold here. There was our revenue integrity program design, as well as the CDM and charge capture audit. With the program design, it was looking at what are the hospital and the physician functions within that revenue integrity program. So again, like we had talked about before, what are we including within here is the CDM charge capture. Are we talking about including denials, underpayments, your, payer strategy pricing in here? So really looking at what are the policies and procedures. Once you've identified that, within this particular client, they decided, again, talking about priorities, when we're building out that department, what are some of the quickest, easiest wins that we can get in? What's going to be the fastest to kind of integrate versus what are some of those areas we can pull in at a later date? And so this was really around charge capture, revenue reconciliation, the CDM management, and then looking at denials prevention and underpayment recovery. So once you stand up that department is then responsible, again, going back to how are you going to communicate, how are we actually going to start evolving and preventing and improving, and subsequently they created a denials and avoidable write-offs prevention committee, and they really broke it out into 4 areas when they broke it out. So we talked about those, work groups from that steering committee. So we had your hospital billing, your professional billing group, your front end, and then your clinical areas within there. And so within the clinical areas, there was a heavy focus on, case management, for example. So in addition to that, they looked at the staffing of the department. So if we're looking at all of these different areas in here, charge capture, rev reconciliation, denials, and underpayment, what does the staff look like to be able to support a department, at least at the basics? So again, looking at what do we need now from the short-term perspective, what can we look at growing into in the long term? And so they also identified key opportunities, again, once that department was stood up in each of these areas. So heavy focus on claim edits, looking at charge reconciliation that wasn't being done, and then again, like we said, the denials management piece of it, and starting to bring that committee. So concurrent to that program design, another piece was looking at the CDM and charge capture audit. Frequently what we see is the CDM outside of, looking at your annual CPT HCPCS, there typically is a lack of process identified for how you're auditing that CDM and how frequently it's being done to make sure that, your revenue codes, your CPT HCPCS codes, your prices, everything that's assigned to that CDM is in there and accurate. And so while we did the revenue integrity, we also were looking at that CDM and charge capture. And so really looking at and training the right people to complete that charge entry and reconciliation, right, if they're not doing it now. Implementing a revenue guardian program. This particular client was using Epic, and so revenue guardian can be built directly in Epic to actually capture or identify certain accounts that could be missing charges. But this would be the same if there's an external tool for another system like a Cerner or Allscripts. And then establishing a change control system for that CDM management and audit. So we did it this time around. How do we make sure that this can be done from this organization's perspective on a recurring basis in the future? So key accomplishments here, we're actually able to add 9 new positions dedicated to the revenue integrity department. And so through that denials and avoidable write-off prevention committee actually implemented write-off strategies and increased net revenue over that first year by $10 million. Hired a revenue integrity director, again, to lead those 9 additional staff. Going back to looking at technology and the vendors. And so looking at your vendors, this one, they decided to keep the vendor that they had, but, really work with that vendor, through reporting, again, consistency and holding individuals or vendors accountable, but led to $2 million in benefit looking through those $0 accounts. Reports, so creating a revenue monitor report at the cost center level, so really looking at every single area, every cost center to look at fluctuations in revenue and making sure that all areas were at where they were expected. Looked at overall denial follow-up workflows, making sure that, again, back to Andrew's point, they know how to identify true root causes for those denials, as well as who are the sources and the owners of those denials. So where and what area was this denial caused, and then who's responsible for working this denial. Improving overall communication and visibility. So again, making sure that there's an annual CDM and specialty-based charge capture audit in place. So meeting with all those clinical areas on an annual basis, going through their CDM and making sure that they understand what's in there and how do they capture and when do they capture those charges. And then making sure that they're identifying champions. So going back to that accountability, that people block. Who's responsible for this, putting a name on it, and making sure that there's somebody to advocate on that behalf. And then again, implemented those revenue guardian checks, specifically around anesthesia services, missing surgical supplies, and then ED service levels. So
Again,
this was the first.
I think for this client specifically, I think of the 9 new positions, I think 4 or 5 of those were transfers, and the other remaining were new positions, or new hire or a new budgeted position. I think what I would say though is that if you look at the 2 from a write-off standpoint and underpayments, is that there was $12 million in annual improvement, and so I think there's a very quick case that can be made from an ROI standpoint by having a team that's doing these types of efforts. So I would say oftentimes there is a little bit of a lift from a resource standpoint. But we see that the dividends are definitely there on the ROI.
Absolutely. And I think we see a very similar thread on this next client as well. And so I won't go through and kind of regurgitate everything that we went through in the previous slide. But this system is 8 hospitals, 90 clinics, just over 1,500 beds, and 1,200 employed physicians on here. Very similar structure to how we approached with this client. So CDM and charge capture audit, as well as the revenue management program design. So very similar themes here. This client, again, when we looked at focusing, the areas, again, were most around the CDM, the charge capture, the reconciliation, and then denials management. This client also had a heavy influence, and actually their revenue integrity department also includes their payer strategy group. So if you think about pricing strategies, payer strategies, and underpayments fall under that group as well. So very similar. I think the difference, we saw denial management, and then we think, more of a comprehensive kind of tangential group with that payer strategy. Key accomplishments here. So this system was able to find through their CDM and charge capture audit over 3,000 errors in charge code build. So that goes back to, inaccurate, inappropriate revenue codes, your CPT HCPCS codes. There could be some pricing issues or $0 pricing in there, modifier assignment if it's assigned directly on that code. So many different components there. Also found 4,500 charge codes that were identified for consolidation or standardization. So when you're talking about a big system like an 8-hospital system, are there, are hospitals completing, standard services or similar services that they could actually be using the same type of procedural or charge codes? And can we standardize it and make it more simple for the system? Automated, so we go back to what can you do that starts automating things to take the people out of it. So automated the alt code assignment. So this could be for your, alt CPT HCPCS code, your alt rev codes on here, but really having the system drive it based on, logic with the information on that particular account. Here, they created 6 new positions dedicated to revenue integrity, and similar to what Andrew has said, I believe 4 out of these 6 positions were actually taken from another area and just transferred over into revenue integrity, and they created 2 additional positions. And thinking about this is their short term. I also know that long-term strategy, as long as they can demonstrate benefit, like Andrew said, with the $12 million from the last client, once they demonstrate benefit, they're able to expand that department further with more individuals. So in the 3 months that we were there, accelerated $17.5 million in gross revenue. And so that was looking at, when we're looking at the pre-AR there, so that's the edits that we're looking at, your late charges, how can we move things through the system faster and more accurately, and then achieved over $13 million in net revenue benefit related to the reduction of avoidable write-offs. So again, similar theme as what we were talking about on the last client, developing that committee and really being dedicated to that denials management and prevention strategy, and looking at root cause to what's being written off, why is it written off, and let's correct this. Improved communication again. So in addition to the denials steering committee that they had, they also had a revenue management steering committee that they had all of the executives across the organization at, as well as when we talked about stakeholders, stakeholders from all of those areas that they could talk to and speak to at a hospital level, at a physician practice level. What does revenue look like, both from a gross and net, and what are the key influencers that are either driving it up or down? And then weekly service line working sessions. So this area identified 3 specific clinical areas to focus on at a time that had the highest impact. And so on a weekly basis, the revenue integrity team would meet with those clinical areas to really start driving improvements around either gross revenue or net revenue through some issues they were having with denials, for instance. Created reports again, and then identified through that audit 100 charge capture audit opportunities across the system. And so that goes back to those 100 charge capture opportunities go into that weekly service line working session that revenue integrity helps facilitate those meetings to get clinical operations to kind of work through those opportunities and improve that charge capture. So 2 examples of successful revenue integrity department or program implementation that definitely can be used to demonstrate the importance of this and that there's benefit behind it for all of your organizations. And so with the 5 or so minutes left, does anybody have any questions for Andrew or myself?
All right. Well, if there's any questions, you all have our contact information here on the last slide. I believe that HFMA Georgia will also be sending out the slides to the group. So definitely don't hesitate to reach out to Amanda or myself for any questions or any other items that you may want to discuss with us. So appreciate everyone's time and look forward to chatting with you all soon.
Thank you, Amanda and Andrew and Maureen. Thank you so much.
Bye-bye now.
Bye-bye.